Hey everyone, it's Maurice, the Healthy Speechy. Well, after my dental visit today, I figured we should talk about oral care. I personally get my teeth cleaned every 6 months. And that usually includes an x-ray, although I haven't been doing the x-rays because of the pregnancy. I'm just holding off. In relation to our patients, oral care is extremely important for everyone across the board. As we get older, our dentin, so like the hard stuff, starts to wear off with the different things that we eat. Our breath may change with medications or just age-related lack of saliva production, and those are all issues. Another concern that we come across is our NPO patients. Oral care is even more important for our NPO patients or patients who are on pleasure feeds per se, or free water protocols, which some facilities do implement. The reason those are so delicate is because if they have any sort of bacteria in their mouth, it can go ahead and transfer to their lungs quite easily if they're aspirating anything, which could make it 100 times worse, and end up with bacterial pneumonia and things like that, along with aspiration pneumonia, I guess, both of them. So for our patients, our goal is to encourage them to brush their teeth every day, at least once a day, if not more, to make sure their teeth and gums are healthy. The other thing you'll come across is that in general, your gums and your teeth are connected to your heart. It's crazy how connected they are, but oftentimes, well, not oftentimes, but it does happen where you have a dental infection and then you end up with a heart problem because of that, because it's so vascular in this oral area. And so we want to be very careful with that, especially as we get older in age. In relation to the PEG patients, the best way to provide oral care, PEG patients who are NPO typically have a yonker, so it's a long bent plastic rod that's connected to a suction, and that yonker is used to help clear out secretion, so any sort of saliva, mucus, things of that sort. They do have adapters that you could switch out for that plastic yonker, and it'll have a toothette, it'll have some mouthwash, some oral care stuff, along with the ability to suction, which is great because it allows the patient to have appropriate oral care along with hopefully not having any sort of penetration or aspiration of the liquids. These things are very important, especially for the patients who are lower cognitive abilities. We want to make sure that they're as safe as possible. And the other thing is you want to make sure that the oral care is being done. So as a speech pathologist, we're not billing for oral care because we can't, it's not a billable code that we could use, but it is a service that we can help provide and educate and train. Excuse the dogs as they're eating. We could train and provide education to caregivers on the importance of appropriate oral care. And yeah, there's been times when I was working at a nursing home where I would go into a patient's room and I would look at their mouth and wonder when was the last time anyone even opened their mouth. They had dried mucus, dried phlegm. It was coating or layers, and in some cases there were plugs of mucus that you would end up clearing out as you're cleaning their mouth with the toothette or the oral care suction kit. And it's horrible when you think about it, how unappealing that must be for that patient to have such severe oral problems and not be able to say anything about it or do anything about it because they may be paralyzed or they may have poor cognition or a variety of things. So it's important for us to always advocate for the patients to have the best oral care. That way, hopefully they continue to have the best quality of care as a whole. It is everybody's job, so it's not just nursing or CNAs. it's OTs, it's speech therapists, and sometimes even the physical therapist, that we charge and help to get engaged in providing the best quality of care services as a whole. So, yes, long story short, brush your teeth, floss, go to the dentist, and make sure that if you're working at any sort of facility that you have patients who have PEGs or NPO or poor cognition, that we're helping them to continue to have good oral care, because it is so important to maintaining our highest quality of life and overall living. Brush your teeth. Have a good day, and thank you. As always, feel free to just subscribe below. Tell your friends, share the link, and yeah, follow me on social media. I'm there. Until next time, bye guys.